Every month, hundreds of people come through the doors of Sheffield's sexual health clinics. A lot of them feel nervous, embarrassed, vulnerable, worried about being judged. I know, because I was one of those people. I was so relieved when I found the service to be so friendly and welcoming.
It's a balance we need to make sure that we get right, prioritising the people that use the services with a mix of real clinical accuracy and precision. In some cases, we're dealing with very complicated medical issues, but to make sure that people feel comfortable coming here and receiving treatment, we need to make sure that our people skills are as finely tuned as our medical ones. I think we've got the balance right, and I'm determined to keep it that way.
At Sexual Health Sheffield, you're always a person rather than a patient. They put people first, and it's reassuring that the service is part of the NHS.
We work with people from all walks of life. Alongside offering a clinical service, we are also trying to provide a safe place for patients to come where they feel able to ask questions, feel at ease, but also leave the department feeling positive about themselves, knowing that they're leaving well informed about all the treatment and options and outcomes available to them.
Like every other field of medicine, prevention is always better than cure. Not only is it cost effective, but also in the long run, it's better for people that they have the knowledge and the skills to look after their own sexual health. So much of what we do is about raising awareness, so it's really important that we continue to get those messages out. It can be easy to forget that poor sexual health can impact significantly on somebody's life. In fact, it can be a matter of life and death in some circumstances, which is why it's vital we continue with this approach.
Over 1,000 patients attend the service each week, but we also offer community outreach sessions to make sure that people have got access to contraceptive services, screening, treatment for sexually transmitted infections.
It's not easy to mix real clinical expertise with a patient-centred culture that excels in health promotion, but that's just what you have to do, and that's how we see it.
Ideally, we'd actually like to treat fewer people by empowering people to make their own decisions about taking preventative measures and looking after their own sexual health. That's why we use all the tools at our disposal, including social media, including modern technologies, in order that we can get our messages out there to as broad an audience as possible. And we know that that's effective, and we know that that works.
Seeing the work that Sexual Health Sheffield does as a patient, seeing how much the service made a difference to me, to my life, made me want to get involved, to make a difference too. So I became a volunteer.